As Marianne mentioned, my name is Leah Prencipe. I'm going to be presenting a paper that was hot off the press, just released at Lancet Planetary Health, and it's looking at measures of climate distress, climate-sensitive risk factors, and associations with mental health in Tanzanian youth. So I don't think I need to spend a lot of time on this slide because I think we all are here for a reason. The idea that climate change is cited as the largest threat to global health in the 21st century in the Lancet, but also in day-to-day life, you can see in social media, in the news, you see all of the people kind of crying out about this crisis. And but at the same time, we have this, wealth of information of young people getting out there on the streets and talking about this. There's still very relatively low amounts of research related to the impacts of climate change on mental health. So these gaps in evidence are really acute in the global south. And, most studies are from the global north, and we don't have a lot of perspectives from people who are living on the front lines of climate change and how it's impacting their mental health. So that was like a big motivation for this study in general, to really get into a population that their voice isn't being heard. So, and then lastly, the idea of focusing on adolescents and young people, it's really crucial because mental health disorders place a huge burden on their well-being. It has lasting consequences, not only in the immediate, but throughout their lives. Mental disorders can be persistent, they can be debilitating, and they also can be transferred to future generations. So it's really important to kind of address these issues among young people as quickly as possible. So let's see. Okay, so the research on climate change and mental health, there's many kind of frameworks on how climate change can impact mental health. And I'm giving a very, very brief summary, so I apologize, but I just want to give you a kind of an idea of what most of the frameworks kind of focus on. So there are the direct effects on mental health. So a good example would be when you have an acute or a large extreme weather event, floods, hurricanes, any kind of large natural event leading to a stress response or a trauma response that in turn is affecting people's mental health. And then there are indirect effects. So again, you have this physical exposure to some sort of climate event, and it could be even subacute event like droughts or heat waves. And these affect the social determinants of mental health. So by reducing access to food, to water, to affecting people's livelihoods, these conditions may in turn impact mental health. And then this last one is commonly referred to as this overarching issue. So this overarching concern of climate change leading to these negative climate-related emotions. So you, I'm sure, have run across a lot of terms like climate anxiety and eco-anxiety. And this field of research is among the three probably the newest and the least understood, because at the same time, these negative emotions are stressors. They're also kind of natural responses to a threat and should not necessarily be made into a diagnostic or pathologized. Being anxious about climate change is kind of a natural reaction to a threat, but understanding how these negative emotions can impact mental health is something that's kind of a new field of research. So we decided to do the study in Tanzania, and I'll give a very brief overview of the study design. So basically we had this large longitudinal evaluation that was conducted in Iringa and Mbeya regions of Tanzania. And about 2,500 adolescents were interviewed for this evaluation in 2017. And at the time, in order to be eligible, they were 15 to 19 years old and enrolled in a social protection program, basically meaning that they were living at or below the extreme poverty line. So this program really targeted the ultra poor in the country, and still does. It's a national intervention. And so for this study, we included all young people who were re-interviewed in 2021, and we ended up doing quantitative surveys where all of the instruments were translated and piloted in Swahili, and the interviews were done in face-to-face settings and in these rural communities. So our mental health outcome that we used for this study was we used the depression. We referred to depression throughout the article, and depression was defined as having a 10 or higher on the Center for Epidemiological Studies depression scale, 10-item version of the scale. And it has been, this scale has been validated in African context, also in Tanzania among young African Tanzanians. And also I just want to clarify that we use a binary indicator in this analysis. So basically, when the CSD 10 is higher or equal to 10, that is indicative of a youth exhibiting depressive symptomatology. Basically, what I'm trying to say is it's not in itself a diagnostic measure, but it's been used to indicate clinically relevant levels of depressive symptoms. So for climate change measures, this was kind of done, of course, everything was done in working among many people in Tanzania and also colleagues, other co-authors. But we started off with just kind of asking, we didn't understand exactly what to expect when we're going into these very rural areas. So we first just started with a question about how much they know about climate change. And this was a question taken from Gallup World Poll, because we wanted to get a kind of an understanding of, where these young people were in their understanding of even the terminology. And we had the options were never heard of it, know something, or know a great deal about climate change. And for many of our analyses, we dichotomized this just to basically say, the young person is aware of climate change or not aware of climate change. And this is referring to the terminology, if they're aware of the term. But with the understanding that some of these young people may not actually be familiar with the term of climate change in Swahili, but they may be aware of the situation, they may be experiencing climate change. We wanted to make a really inclusive measure of climate change distress. So we asked them, how distressed are you about changing weather patterns and changing seasons? And the idea was, instead of using the Swahili term and using instead a definition of climate change, even young people who maybe aren't familiar with the terminology but are experiencing climate change can report on their feelings about the situation. And this we had ranging from not at all to extremely. We dichotomized this for analyses to say if they were at all distressed versus not distressed. And we have some other measures here. We included youth characteristics, basically to try and understand, because it's an exploratory study, we don't really know what to expect. We want to understand who young people are who are feeling distress. We want to understand what kind of indicators may predict their feelings of distress. And these indicators were also relevant in other studies looking at climate change, perceptions of climate change, perceptions of risk for climate change. So we kind of included them to understand who is feeling distress over climate change. And then we also have two categories of climate sensitive risk factors, trying to understand if young people who are at higher risk of poor outcomes if climate change worsens or conditions worsen. So people who rely on farming for their income, who are, have livestock. So the kind of livelihood activities that make people vulnerable to the effects of climate change, but also, could be something that helps them get through climate change. These are just kind of different kind of activities I think we found relevant. And then we have living conditions. So climate sensitive living conditions like food and water insecurity, exposure to floods or droughts. So the idea is that people who are already food insecure are more likely to be vulnerable to climate change, but also climate change can cause people to be food and water insecure. Okay, so I would say that our kind of main research question starting off was to try and understand if climate distress was related to worse mental health. So that's kind of like our starting point for our research question. But we also wanted to understand if exposure or risk to climate events. So again, these climate sensitive risk factors related to more climate distress. So if you rely more on the land for your living, are you more worried about climate change than if you're not living in climate sensitive living conditions? And finally, we also want to understand if these conditions were directly related to worse mental health. And there's some evidence already from many other researchers who found relationships between, for example, being food and water insecure and having worse mental health. But again, these young people are people. They have, it depends where they live, their education level, their marital status, all these kind of different social and cultural and demographics are important for not only their mental health, but also potentially for their feelings of distress. And finally, climate awareness. It wasn't really our intention to focus on climate awareness specifically, but it did seem to be a very salient predictor of who was going to be distressed about the climate change. So basically, young people who were more aware of climate change tended to also be more distressed about climate change. So there's an obvious relationship where people live, their education, who they are predicts climate awareness as well as climate distress. And we did not find much evidence to show that those who are at our version of climate sensitive risk factors, that they were more likely to be distressed about climate change, generally, for the most part. We did find that there was a relationship between living in conditions that make people vulnerable to climate change, and also conditions that are potentially caused by climate change are more likely to be depressed. Which again, that is part of previous literature as well. So we kind of confirmed that. And finally, for our main research question, what we started off trying to understand, we did find that young people who were more distressed about climate change were also more likely to have depression, according to our measure. And there's a lot more, but I'm glad I kept it short because I took so long to get this up. But I think that what really stands apart for this article, and I really hope that we continue to do more on this subject, because climate change and mental health studies almost exclusively look at one pathway. So in order for us to kind of think more about the larger impact of climate change, focusing only on major climate events and seeing how that impacts mental health is kind of ignoring the overarching despair that's happening on a global scale among young people. And focusing only on things like eco-emotions kind of takes away from the people who are living it, living in the front lines of climate change. So I think more one of the biggest takeaway messages is that living in conditions worsened by climate change and feeling distress about climate change were both associated with worse mental health. So it's not just one pathway. And I think more research should really study the different pathways that can lead to poor mental health among young people. And populations living in the global south are the least represented in the literature. Again, I mentioned this earlier, but the fact that we had these face-to-face interviews in remote settings in a local language, I think it was really important to reach these young people who are not really, they don't have a platform. And finally, there's a lot of debate in this new field of research where, there's no standardized measure. What is climate anxiety? What is a measure that really captures how people are feeling? But the thing is that most of the existing measures are validated and used in high resource settings, and they may not work for remote or culturally diverse populations. They typically don't use more inclusive language. So they make the assumption that young people will be familiar with the terms like climate change. So it's really not reaching climate illiterate populations. And then by using survey items that were translated, they use inclusive phrasing. And I do think that helped us to get a perspective from young people who really may have varying levels of climate literacy, but it really just aren't in the literature. And I wanted to take a minute to acknowledge the evaluation we got the data from. All of these people were involved with helping us collect the data. It was a very big operation. So it's not just a small thing what they contributed. And finally, this I just want to point out, if anyone is interested in climate change and health, I came across this book when I was doing my research for this paper, and this is a book by Vanessa Nakate, who you may be familiar with. She's a Ugandan climate activist, but she really discusses what it's like from an African perspective to be engaged with the climate activism community. She also gives a really readable and accessible overview of climate change and health in Africa. So I highly recommend it. And I don't have any ties. I just really want to use this platform to share her work, and hopefully more people will read about African perspectives. And that's it. If there is a lot more in this paper, I highly recommend, if you're interested, to take a look at it. There's the link, and please, of course, contact me through my email if anything. Thank you.